Welcome to Navigating with witHIIN from the Hospital Improvement Innovation Network team at the Iowa Healthcare Collaborative. My name is Lana Comstock, and thank you for joining us.
Today we will have Brett Altman, CEO at Cass County Memorial Hospital in Atlantic, Iowa, here for our topic of conversation on hospital leadership engagement and quality. Brett has achieved his doctorate in physical therapy and also another master's as Executive Masters in Business Administration. Brett joined Cass County Health System January 1st in 2017. Brett joined Cass County Health System January 1st, 2017 as CEO. Cass County Memorial Hospital has received the iVantage Performance Leadership Award based on quality and outcomes for the past 2 consecutive years and counting. Hey, Brett, thanks so much for taking time out of your busy schedule to have a conversation around hospital leadership engagement to drive quality. As we start our podcast today, I'd like to ask you to weigh in on the CEO role to engage quality throughout the hospital, and wondering if you have some best practices that you could describe, maybe some things that you've identified.
Well, thanks for having me, Lana. First, I would say, it's the people within an organization who are the major determinants in terms of the quality of care that hospitals provide. So it's important for hospitals and health systems to engage every member of the team, whether it's physicians, clinicians, or even non-clinical employees, so that we can reduce variation in operations and quality. We do have some clinical dashboards that we've identified to help us with our performance. And we also have some organizational-wide action goals developed to help improve any area of concern. So quality is something that we feel is never complete. There's always new benchmarks to achieve and new processes to be improved. And while we're not perfect, we continually strive for perfection.
Awesome. That's excellent. There's no doubt that we're always in that continuous mode. So one of the things I wanted to ask you as well was, when you think about the hospital's quality strategy, then how do you link that within that quality assurance performance improvement plan? What does that look like?
Well, for us, we start by linking our mission, vision, and values to our organizational goals, and tie that in with our quality assurance performance improvement plan. So we work really hard to communicate a clear, consistent message across the organization so that everyone can understand and every team member is able to recite our mission, vision, and goals, for example. And we have 4 overarching goals here at Cass County Health System. And at the top of that goal list are our quality and safety goals, including patient satisfaction. And so we use measurable data to ultimately attain better outcomes. And again, we just consistently communicate those same things with all of our staff at every meeting.
That's excellent. That's a great strategy for sure. One of the things that I know is important as well is board engagement. So I'm wondering if you could help us understand, how does a hospital board really help in driving quality within the hospital?
Sure. So the board is ultimately responsible for quality, and they can really help set the culture by their engagement in the process. So, for instance, we have a monthly quality committee or quality council, and the board aids in their engagement by being active participants in that council, providing input or challenging the status quo if needed. And again, the board is ultimately responsible for quality, and they take that very seriously.
Excellent. When we think about a hospital implementing a new quality initiative, Why is it so important to have the administrative team of the hospital supportive of these initiatives?
Well, without administrative support elevating quality as a top organizational priority, any quality initiative is likely to fail. And so quality initiatives require time and dedication and resources. And it's important that administration supports, the urgency of quality with the appropriate tools, staffing, and holding people accountable. So like the board, administration needs to be an active participant in quality reviews, quality committees, quality councils, asking tough questions, complimenting progress, and challenging the status quo.
We know that most of our initiatives that we've done in our works with hospitals have the most success when the leadership is engaged in that with the quality division. So what you're saying hits home with me. Brett, what are your thoughts related to how quality professionals can work with the hospital leadership? Are there some techniques, some things that you have to offer that we can share with our quality professionals who are listening today to our podcast?
I think many of our hospitals are blessed with some of the most talented nurses and clinicians that have migrated into quality because they just kind of have an affinity to be detail oriented. And so I just start by saying it's really helpful that our quality and performance improvement departments are oftentimes centers of excellence in our hospital already. That said, as previously mentioned, it is not all about those quality professionals. It's everyone's job, and quality and performance is everybody's responsibility. And, I think what quality professionals can do is just be very transparent, both with hospital leadership and staff, in terms of explaining the why it's important as we try to elevate our quality scores and measures so that people are motivated, and quality professionals help facilitate meaningful enhancements as a strategic priority for our facilities.
That's perfect. We often let our quality leaders know when we're working with them that a big part of their role is really serving as the orchestrator of that band, so to speak. That they don't have to necessarily do all the work, but that they just have to orchestrate and help. And that transparency and communication is so huge with all of that. Brett, I really want to thank you for giving us your insights into the hospital leadership role with Quality Works for your hospital, and kind of the overall takeaways that our quality professionals have after hearing you speak today.
Well, thank you very much for having me, and I just am excited as we as a hospital community continue to get better and elevate our value and quality throughout the region.
Awesome, thank you. Again, thank you for joining this episode on the role of the hospital leader in driving quality. Please remember that the Iowa Healthcare Collaborative's Compass HIN team is here to assist you in all of your quality work. So don't forget to reach out anytime.
Thank you for joining us today. If you'd like more information or have a topic idea that you'd like to request, please contact anyone on our HIN team. Thank you.